sleek, it's modern, it's bright.
Patients can feel comfortable sharing their story and their journey with our clinicians. That's the first step.
This is absolutely fantastic. It's a great way for mental health patients to start their recovery process.
What a great video that brings in the conversation that I want to have today with Dr. Stephen Stokl, who's a psychiatrist down at Southlake Regional Health Center. Dr. Stokl, thank you so much for being on the show.
Thanks for inviting me down. Appreciate it.
No, it's a great opportunity. I mean, mental health has been a huge topic for a long time, and it's something that we're seeing more awareness brought to. And to see some of the efforts of Southlake Regional Health Center and yourself and your team is rather remarkable. Can we talk a little bit about some of those efforts?
Well, yeah, it's I will say that we've been very fortunate that in September we were able to get our new psychiatric emergency mental health assessment unit, which was what the video portrayed. And that really is cutting edge. It's very clean. It's got showers. It's got room. It's got space. It's a very good place. I think, as one of the individuals on the tape said, it's a great place to start a recovery journey for many people coming in crisis. And now, of course, we're trying to look at to get 12 more beds, inpatient beds, because of the huge growth in this area in Newmarket. Being on the Yonge Street corridor, all of the group homes close by here. So by having 12 beds, the patients won't be as crowded, which is very important.
Yeah, no, absolutely. And, you hit on a key point too, that everything is nice and bright and light and airy. It's, it certainly has a far more appreciative look for somebody to heal in a mental health situation.
Mm-hmm. I mean, environment is so important. If you look at the environment for any of us, I mean, people say, well, what's the cause of this disorder? Is it nurture or nature? Well, nurturing the environment, our social cultural experience plays a big part in all of our mental health. Take COVID, for instance. That's a big part of our social cultural life right now. And of course, all of these psychiatrists and mental health staff are busier now than ever. So it's a very important part.
Yeah, absolutely. And, I was reading through some briefing notes that we had chatted about earlier, and they're saying on average, 17 patients come into your emergent per day experience mental health crisis.
Yeah, it can be very, very busy. It's, thank goodness, of course, we have the YRP to help us out a lot. I find all of them so very helpful. It's like they're all very well trained in terms of discerning mental health issues and separating it from other issues. And, had one of my colleagues describe sometimes our emergency room as a war zone. Not that I've ever been in a war zone, thank God, but it does get very, very busy. And so by having this emergency mental health assessment unit now, that's a much better place for people to start to be taken care of, individual rooms looked after. But obviously we still have other patients who are waiting in our general emergency room. And even those patients in this new unit, they're waiting for a bed on the inpatient unit so that further engagement and treatment and group therapy and individual therapy and medication or whatever else is necessary, occupational therapists. And sometimes they're put on hold and can't even be transferred for 2 to 5 days, let alone other patients who might be scattered somewhere else throughout the hospital. But now they really need a psychiatric admission, let's say from medicine or surgery, based on what happened to them. But they have to wait and be languishing there for 2 or 3 days before we even get a bed, because there are simply not enough adult inpatient beds. And that's really what we're trying to do. We need 12 more beds. We need them a decade ago. We're just right at the pinnacle now in terms of achieving it.
Yeah, and you'd mentioned with COVID. I mean, that's obviously had an impact. We see it and feel it, even just speaking with our own family members. That the stressors and the day-to-day life has changed for so many people, and sometimes it can be overwhelming.
Well, very much so. I mean, I think for a lot of general people, any of us, even if we haven't been struck with mental illness, many of us feel this COVID fatigue, the blah, the lack of motivation, the COVID 10, 15 pounds that everybody's putting on. Anxiety. Anxiety is another big one. It's probably the number one medication I have prescribed more than any other is lorazepam, which is an anti-anxiety medication. Now you add this kind of oppression, this kind of social isolation, this sense of not belonging, sense of not being able to reach out, have a physical hug or anything like that with people who are already marginalized, isolated, feeling like no one cares and no one really, they have no value to anybody. It worsens things. And so it's just loaded up our emergency even more.
Yeah, absolutely. And it's so good to see, though, that Southlake Regional Health Center has obviously worked very hard on expanding this. It didn't just happen overnight. There's been a lot of efforts put into expanding the efforts for mental health and mental readiness. I understand there's some government support, and of course, you're reaching out to the community as well with some campaigns. We're starting to see those campaigns out there now, and we'll actually have that. We'll put that website up on our page as well to help share that with people.
Well, that's terrific that you can do that. I think that none of us can really say, do we not have a loved one or a relative or a friend who has not struggled with mental illness? I mean, it hits all of us. We're all somewhat depressed and paranoid and psychotic in varying degrees, right? Everybody has some problems. So that to be able to have some help from the community to get this, it's just so frustrating and hurtful for people that when they finally do come for help for a loved one, and then they realize, oh my goodness, it's not just automatic. I'm not just going to get the fracture reset. I'm not just going to get blood taken. I'm not just going to get a CAT scan done and then everything's okay, or have my appendix removed. Oh no, this takes much longer to do, and you need an inpatient setting for this. And now they realize, okay, like there are some resources that are necessary here, and we need cutting edge resources too, Don, in order that we can invite other graduating psychiatrists to come here to work with us. Some young people to expand, and because this is a very huge growing area. So if we can get that would be great, and not just have maybe white-haired people like myself.
No, but it's so true. I mean, reading again through the briefing notes that were provided, all levels of medical require different treatments, and there's nothing quite like mental health.
That's for sure. It's, we think about depression, just think of being a little bit down, and now thinking of when you can't eat, you can't sleep, you don't want to talk to anybody, you're thinking of suicide, or you have something unreal, you feel somebody's following you or laughing at you, or you're having uncontrolled panic attacks, you can't go to work, you've been off work, you don't know where to turn, no one really seems to understand you. They may not understand if you've got a red face or you've got a broken limb or something like that, but this is the invisible illness that just takes people out of the game. And of course, that's the group that we're trying to help out.
And it's also from an outsider's perspective, it's identifying, isn't it? I mean, you said if somebody has a fracture, well, that's pretty easy to identify. Mental health maybe not quite so easy.
That's correct. It's and yet we all feel it. We've all felt varying degrees of anxiety or varying degrees of sadness at various times. But now you have to think of this in depth, such that, a person can't relate anymore to their spouse or children, or an adolescent can't relate to their peers, or someone can't make it in school, or, a relationship is breaking up, but, you feel too ashamed to talk about it. And who do you talk until it's too late? And then there could be some tragedy, which we want to avoid, of course. By having a larger inpatient setting, my goodness, we're going to be able to take care of so many people. They'll be able to come in, go through our emergency mental health assessment unit. From there, be transferred to our inpatient ward, and treatment commencing very, very quickly. They're looked after. When I came here, Don, several years ago, there were actually 34 adult inpatient beds, 34,
Wow.
each with their own room. And we had a very active patio with horticultural sites for gardening. We had a pool table, we had a ping pong table, we had a piano. We don't have patio now. We have none of those amenities. We don't have
Wow.
horticulture, none of that. We have 24 beds where there are often 30 beds stuffed into patients stuffed in there. And so they don't feel very comfortable at all. The space isn't there to get well.
Yeah, that would be a very hard setting for somebody to be reset with mental health, wouldn't it be?
Yeah.
Right. And we hear about that all the time, the overcrowding at hospitals and the, and perhaps the understaffing. I mean, you've had some pretty tall challenges to jump over.
Well, it is. And there's other people, of course, who have very serious long-term mental illnesses.
Sure.
There are many group homes around this area. About 30% of all the homes for special care and group homes really in the province are located right here within grasp of our hospital. Eight of these are within walking distance to the hospital. These are people with schizophrenia, schizoaffective disorder, bipolar disorder, acquired brain injury, maybe a dual diagnosis, maybe some developmental delay, and these people relapse, right? And so
Wow.
we have a need to take care of all of these people.
Yeah, absolutely. And, that we mentioned in the earlier segment that, one of the things is to, try not to let it go too long. If you do identify a family member, a friend, somebody, or yourself that might be suffering from a mental disorder, find some help. There is help out there. We'll put some of that information up on the screen, right? So that we want to get that message out there. You get the help as early as you can. But Dr. Stokl, I've got to thank you so much for your time. I know you're a rather busy gentleman down at Southlake Regional Health Center, but it's been an absolute pleasure having you on, and I definitely look forward to speaking with you again in the future. And best of luck with the endeavors down at Southlake.
Well, thank you very much, Don. Thank you to YRP too. Appreciate your help.